Ever feel like healthcare and education are kind of like ships passing in the night? Should be
Mhm.
working together, right? But often they're not.
Yeah.
Well, today we're diving into a model that's trying to change that,
Okay.
the central center.
Mm.
It's not just a building, it's a whole philosophy.
Mm.
And we're going to see how it's making a difference, especially in places that need it most. We've got a detailed article here that lays out the whole central center model, the good, the bad, and the really interesting stuff.
Right. I think what's really cool about the central center idea is it acts like a bridge, recognizes how important both health and education are for a community to really thrive.
Okay, so let's break it down, starting with the central center as a community health hub.
Yeah.
What's that actually look like, in real life?
Think of it as a place where you could go to a workshop on managing diabetes.
Hmm.
Or maybe there's a community health fair. You can get some free screenings, even resources to help you quit smoking. That's the central center in action.
Mm.
It's all about giving people the tools and knowledge to take control of their own health.
And a big part of that seems to be these community health workers. The article really highlights them.
Oh, absolutely. Community health workers, we call them CHWs for short. They're like the heart and soul of this whole thing.
Right.
They get special training to provide basic health care, educate people about how to prevent health problems, and really importantly, build trust between the community and the healthcare system.
Right.
They're like trusted guides, especially in areas where people might not be so comfortable, going to a doctor or a hospital.
Yeah, I can see that. The article mentions this really interesting example of CHWs working in a rural area. Healthcare is hard to come by there. They actually went door to door, teaching people about diabetes, helping them check their blood sugar, and connecting them with the resources they needed.
It's a perfect example. Shows how powerful CHWs can be. They don't just, give out information. They build relationships, help people feel empowered to take charge of their own health.
Yet it's not about just telling people what to do. It's about meeting them where they are, giving them the tools and support to make their own choices. And that makes me think about those social determinants of health we hear so much about, right? Like whether you have a safe place to live, access to education, healthy food, all those things affect your health.
You're spot on connecting those dots. The central center gets that. Health is about way more than just going to the doctor. They actually try to tackle those social determinants head on, working with organizations to help people find housing, get job training, workshops on good nutrition, managing money, even advocating for policies that'll help reduce those health gaps between different communities.
So it's really about taking a much broader view, recognizing that true well-being needs a supportive environment. Okay, so they're tackling community health in this proactive, empowering way. What about the education side? How is the Central Center doing things differently when it comes to learning?
Well, a lot of times traditional education feels very removed from real life. The central center turns that on its head. They weave real-world experience right into how they teach. So imagine students working side by side with actual healthcare professionals, seeing how things work in the real world, not just reading about it.
So less textbooks, more hands-on.
Exactly. There's this quote from a student in the article. They said, "Learning here isn't just about facts, it's about understanding people, their stories, and what they need." That really sums up their whole approach.
Yeah.
They want to cultivate critical thinking, cultural sensitivity, empathy, prepare students to be the kind of healthcare providers who are ready to face the challenges of our diverse world.
Makes me wonder, do you think this hands-on approach changes the kind of healthcare professionals they become? Are they more likely to work in those underserved areas or focus on community health issues?
That's a good question. And the article suggests that, yeah, being exposed to these real-world challenges during their training does seem to inspire them to go into those fields, to really serve communities.
It sounds like the Central Center is cultivating a whole new generation of healthcare pros who are not only skilled, but also really connected to the people they serve. But let's face it, working in the real world, it's not always smooth sailing. What kind of challenges does the Central Center bump up against?
Well, every model is going to have its hurdles, right?
Hmm.
One big one is navigating all the different languages and cultures, especially when you have students or healthcare workers who aren't from the community.
Yeah, that makes sense. Seems like it would be easy to accidentally say or do the wrong thing if you're not familiar with the local culture.
They've got a few strategies in place. Using translators is one, obviously. They also really emphasize cultural sensitivity training for everyone on staff and all the students. And they use things like visual aids and other creative ways to communicate to help overcome those language barriers.
Smart. Sounds like a steep learning curve, but really valuable for everybody involved. What other challenges come up?
Adapting healthcare to rural settings, that's a whole other ballgame. You've got limited infrastructure, fewer resources, and just by nature, it's harder to reach people who might be spread out over a large area.
Logistically, that's got to be tough. So how do they get around those hurdles?
They've had to be resourceful. They team up with local organizations to share resources, train community members to take on some healthcare roles to expand their reach. And they've even set up mobile clinics to reach people in remote areas.
Mobile clinics, that's brilliant. Taking healthcare right to people's doorsteps. But with all these adaptations and initiatives, scaling up to help even more communities must be a huge task.
You're right, scaling up any successful model, it always comes with its own set of complexities. And the article does point out that there are limitations to how much the Central Center can expand its programs.
What are some of the main roadblocks they run into when they try to reach more people?
Funding's a big one, of course, always is. Replicating the Central Center model, it takes a lot of investment up front. Building infrastructure, hiring staff, developing the programs, it all adds up.
And it's not just the initial cost, right? It's about making sure there's enough money to keep things running in the long term.
Exactly. They have to explore different ways to fund the program, maybe a mix of government grants, donations from foundations, partnerships with businesses that align with their mission.
It's a balancing act, isn't it? Making sure the money's there, but also staying true to what they're all about.
For sure. Another hurdle is just having enough people to do the work.
Yeah.
And not just bodies, but finding the right people. Qualified healthcare professionals, educators, community health workers, all passionate about this model and willing to work in areas that might be underserved. That's tough.
Especially the shortage of healthcare workers in so many places. It's
Ah,
already a competitive field.
absolutely. They might have to get creative with recruiting, maybe offer some incentives, special training opportunities, really highlight how their work is making a difference in the community.
Making it a place people want to work. Attracting the right people who are really committed to the mission.
Exactly. But scaling up isn't just about copying and pasting the same model everywhere.
Right.
Every community is different, different needs, different cultures, different resources. If they just try to cookie cutter it, it's not going to work.
So it's not a one-size-fits-all solution.
Yeah.
You got to be flexible, adapt their approach.
Right. They have to be willing to tweak the programs, the partnerships to fit each community. That might mean working with organizations that are already there, changing up the curriculum they teach, even how they actually deliver healthcare.
Yeah. Like, what if a community has a real problem with transportation?
Exactly.
They might need to ramp up those mobile clinics or offer telehealth services, things like that.
Exactly. It's about finding that balance, keeping the heart of the Central Center model, but making sure it works within the context of each community.
Sounds like getting the community on board is crucial if this is going to work long term.
Couldn't agree more. They have to be seen as partners, not outsiders, coming in to tell people what to do. And that brings us back to that idea of grassroots leadership we touched on earlier.
Right. Empowering people within the community to take charge of their own health. Seems even more important when you're talking about scaling up.
Absolutely. Sustainable change, it has to come from within. When community members are in the driver's seat, they're invested in making it work.
It's about that sense of ownership, of shared responsibility. And that makes me think about the Central Center's focus on, a holistic approach to healthcare. It seems like that perspective's got to be super important when we're talking about creating lasting change in communities.
Oh, it's essential. If we only focus on treating illnesses without looking at the bigger picture, the social, economic, environmental stuff that affects people's health, we're always going to be fighting an uphill battle.
It's like putting a Band-Aid on a wound without cleaning it first, right?
Exactly. The Central Center gets that. They understand that true well-being requires looking at the whole person, not just their symptoms.
Yeah, so how do they actually put that into practice? What does a holistic approach really look like in this context?
Well, they make patient-centered care a priority. That means building a strong relationship between patients and their healthcare providers, having open communication, taking into account the patient's emotional and mental well-being, offering flexible care that works for their individual lifestyle.
So it's not just about treating the disease, it's about treating the whole person. I like that.
Right. And it goes beyond that. They realize that a lot of things outside of the doctor's office can have a huge impact on someone's health, like those social determinants of health we talked about before: housing, education, income, access to healthy food. All that plays a role.
It's acknowledging that health isn't just a personal responsibility. It's also about the environment you live in.
Exactly. The Central Center actually takes steps to address those social determinants. They partner with organizations to help people find housing, get job training, offer workshops on nutrition and financial literacy. They even advocate for policies that try to even the playing field, reduce those systemic inequalities that make some people more vulnerable to health problems.
It's like creating a whole web of support that tackles those root causes,
Yeah.
not just masking the symptoms. That's really impressive stuff.
It is. And they also encourage people to think about well-being in a more balanced way. They offer things like community yoga classes, mindfulness sessions, resources for managing stress and taking care of your emotional health.
So they're really encouraging people to look after their mental and emotional well-being as part of a holistic approach.
Absolutely. They understand that our physical, mental, and social well-being are all connected.
I'm curious, how does this actually translate from theory to practice? The article talks about field-based learning as a key part of their education approach. What does that involve?
Field-based learning means getting students out of the classroom and into real-world healthcare settings, especially those serving underprivileged communities. It's about letting them experience the challenges and successes of community health firsthand.
So instead of just reading about health disparities in a textbook, they're actually seeing them firsthand.
Exactly. The article describes how students get to observe the crucial role community health workers play, which really helps them understand and empathize with that work.
It sounds like they're actively engaging with the community, learning from the people on the front lines.
Right. And they particularly emphasize placements in rural areas as part of this field-based learning.
What's the reasoning behind focusing on rural placements?
It pushes them out of their comfort zone. They have to learn to adapt to limited resources, bridge cultural gaps, and get creative to solve the unique challenges of healthcare in rural areas.
It's like a crash course in resourcefulness and adaptability.
You could say that, but it's more than just a learning experience. It's about instilling a sense of social responsibility, preparing these future healthcare professionals to advocate for better healthcare access no matter where they end up working.
It sounds like the Central Center's not only training skilled healthcare workers, but also raising a generation that's ready to push for positive change within the healthcare system itself.
Exactly. Now, shifting gears a bit, we've talked a lot about healthcare and education, but what about the communities themselves? How does the Central Center approach the idea of community empowerment?
That's a key piece we haven't explored as deeply yet.
Well, it's really the foundation of their entire model. The Central Center believes that sustainable change can only come from within the community itself. So they focus on cultivating local leadership, encouraging communities to take ownership of their own health initiatives.
So it's not about outsiders coming in and dictating solutions. It's about working with the community to find solutions that truly resonate with their needs.
Precisely. They collaborate with communities to identify what those needs are and develop strategies that are culturally relevant and sustainable.
How do they go about facilitating that process?
Well, one way is that they often choose community health workers from within the community itself.
Makes a lot of sense. Who better to understand the community's needs and build trust than someone who's already a part of it?
Exactly. And they prioritize public education and building trust. They organize workshops, health fairs, open forums where people can voice their concerns, get accurate information, and feel empowered to make informed decisions about their health.
It's about creating a dialogue, a space for collaboration. Healthcare isn't something done to people, it's something they actively help shape.
That's the heart of it. There's a quote from a community leader in the article. They said, "When people feel they have control over their health, something shifts. They stop seeing healthcare as something done to them and start seeing it as something they shape."
Wow, that's powerful.
Yeah.
Really captures the potential of this model to not only change how healthcare is delivered, but also transform the relationship between communities and their own well-being.
It's about shifting those power dynamics, building trust, fostering a sense of ownership over community health.
We've covered so much already. It's amazing to see how the Central Center is bringing together community health, hands-on education, collaborative partnerships, and this profound emphasis on empowering communities.
It's a multifaceted approach, wouldn't you say?
Absolutely. But before we go any further, let's take a pause here to let our listeners digest all this incredible information. We'll be back in a moment to delve deeper into the broader implications of the Central Center model and consider what the future might hold for this innovative approach. Welcome back. We've been digging into this really fascinating model, the Central Center. It's kind of redefining how we think about community health and education, It's inspiring stuff. But as with anything new, scaling it up so more people can benefit, that's got to be a challenge.
Definitely. It's like the Central Center's success really depends on those deep roots in the community it serves. Taking that model to new places, it takes careful planning.
Yeah, and in the article brings up some of those hurdles, like funding. That's a big one, right?
Hmm.
To replicate what they're doing, it takes a lot of resources. Building things, staffing, developing programs, all of that, it costs money.
No doubt about it. Sustainable funding, that's the key. They can't just rely on one-time grants or donations. It's about finding those reliable sources of money, maybe a mix of things like government support, maybe help from foundations, or even teaming up with companies that share their vision.
It's about finding that sweet spot, isn't it?
Yeah.
Having enough money to grow, but not compromising their values in the process.
Exactly. And then there's the whole challenge of building the right team.
Yeah.
It's not just about how many people you have. It's about finding those people who are really qualified, who are passionate, who truly believe in what the Central Center is doing, and finding those people, especially healthcare workers, educators, community health workers, in areas that are underserved. That's a tall order.
It makes you think, what could they do to address that staffing issue? Would offering better salaries, better benefits be enough? Or does it take more than that?
Competitive pay, sure, that's important. But it's probably not the whole picture. I think they need to create a work environment that people really want to be a part of.
Yeah.
Somewhere they can grow professionally, feel like they're making a real difference. Maybe offer some unique professional development opportunities, mentorship programs, really highlight the impact they're having on the community.
It's got to be about more than just a job, right? It's got to be about attracting those people who are truly drawn to the mission.
Exactly. And the thing is, scaling up isn't just about copying the same model over and over again.
Right.
Every community is different, different needs, different cultures, different resources they're already working with. If they just try to apply a one-size-fits-all approach, it's not going to fly.
So no cookie-cutter solutions. How would they need to adapt to make sure it works in different environments?
It takes flexibility. They got to be willing to adapt. For one, working with organizations that are already in the community, that's key. Maybe they need to adjust the curriculum they're teaching to fit the local needs and cultural context. Even how they deliver healthcare might need to change. Think about a community where transportation's a major issue. Maybe they need to ramp up those mobile clinics or offer telehealth options, things like that.
Yeah, like bringing healthcare directly to people.
Exactly.
Sounds like scaling the Central Center model is a balancing act. They got to stay true to their core values, but also be sensitive to the specific needs of each community. It's about finding that sweet spot where the model can thrive without losing its heart.
Perfectly put. And that's where involving the community is so important. They need to really listen to people, understand what they need, incorporate their feedback every step of the way.
It's about earning trust, showing them you're not there to dictate solutions, but to work together, build something together.
Exactly. The community has to be on board. The Central Center can't be seen as some outside force coming in to tell people how to live their lives. And this brings us back to that idea of grassroots leadership we talked about.
Right. Giving people in the community the power to lead their own health initiatives seems even more important when you're talking about expanding the model.
Absolutely. Sustainable change, it has to come from within. When people in the community feel empowered to take the reins, they're invested in making sure it works.
It's about shared responsibility, a sense of ownership, which brings us back to the Central Center's focus on that holistic approach to healthcare. Seems like that perspective is really important when we're talking about making a lasting impact on communities.
It's fundamental. You can't just treat illnesses without looking at the bigger picture, right? The social, economic, environmental things that affect people's health. If you ignore those, it's like trying to put out a fire with a water pistol.
Like putting a Band-Aid on a much bigger problem.
Exactly. The Central Center gets that. They know that true well-being means looking at the whole person, not just their symptoms.
So how do they actually do that? What does that holistic approach look like in action?
They prioritize what they call patient-centered care. It's about building a strong, open relationship between the patient and their healthcare provider, really listening to them, understanding their concerns, taking their emotional and mental well-being into account, and offering care that's flexible, that fits into their individual lifestyle.
So it's about seeing the whole person, not just the disease.
Exactly. And it goes beyond that, too. They understand that so many things outside of a doctor's visit can affect someone's health. Those social determinants of health we keep coming back to, things like Housing, education, income, access to healthy food, they all matter.
It's acknowledging that health isn't just a personal responsibility. It's also influenced by the world around you.
Exactly. The Central Center actually does things to address those social factors, partnering with other organizations to help people find housing, get job training, offering workshops on nutrition and managing money. They even try to influence policy, advocate for changes that would help level the playing field, reduce those systemic issues that make some people more likely to have health problems.
It's like building a safety net, a support system that goes beyond just treating symptoms.
Exactly. And they encourage people to think about well-being in a broader sense, offering yoga, mindfulness practices, resources for managing stress, taking care of your emotional health.
So they're saying mental and emotional well-being. That's all part of this holistic approach.
Absolutely. They understand that our physical health, mental health, social well-being, it's all connected.
But with all these different pieces, the healthcare, the education, empowering communities, this whole holistic approach, it seems like a lot to manage, especially when they're trying to expand to new areas.
It's a big undertaking, no question. And the article mentions that one of the biggest challenges to expanding is the need to really document everything they're doing, evaluate the programs, make sure everything's working the way it should.
You mean keeping track of what's effective, what's not, making adjustments as they go?
Exactly. They have to be able to show that their model is working, and they need data to back that up. That's crucial for getting funding, getting support from people who make policy, and inspiring other communities to try a similar approach.
It's not enough to just have a good idea, right? You have to prove it works and hopefully be able to replicate that success in other places.
You got it. And that's where their commitment to that field-based learning becomes even more important.
That hands-on experience we talked about, where students are immersed in community health settings.
Exactly. That firsthand experience isn't just valuable for the students, it's a constant source of real-world data and insights that they can use to refine and improve the model as they go.
It's like a feedback loop. The students learn, the community benefits, and the Central Center gets information that helps them get better at what they do.
Exactly. It's a great example of how education, healthcare, and community engagement can work together to make a real difference. It makes you wonder, what if this kind of approach was the norm instead of the exception?
What if healthcare and education were seen as essential parts of every community, working together to support everyone's well-being?
That's a powerful thought. And the Central Center shows us that it's not just a fantasy, it's a real possibility. But to make that kind of shift, we have to rethink some of our basic assumptions about how we approach healthcare and education.
It challenges us to be more creative, to break down those walls and really prioritize collaboration and community empowerment. There's a lot to unpack there, and we've only just scratched the surface. We'll be back in a bit to wrap up our deep dive into the Central Center, leaving you with some food for thought and key takeaways to ponder. Welcome back for the final part of our deep dive into this Central Center model. We've covered so much, from community health work to hands-on education, and that really key element of community empowerment.
Yeah, it's been a fascinating look at how they're braiding together healthcare, education, and community involvement to create this holistic approach to well-being, really focusing on sustainability, too.
You know what stuck with me is how they focus on empowering people, giving individuals the tools to be the change makers in their own communities, whether it's through the community health workers, the students getting that real-world experience, or just creating those spaces where people can talk openly and make decisions together. Empowerment seems like it's baked right into the Central Center's DNA.
I see that, too. They seem to get that real change can't be forced from the outside. It has to grow from within the community.
It's like they're turning things upside down,
Yeah.
moving away from that traditional top-down approach to healthcare and education. Instead, they're embracing something more grassroots, more collaborative, recognizing that communities already have wisdom and knowledge that can be harnessed.
Makes you think, what if this was the norm? What if healthcare and education weren't these separate silos? What if they were woven into the fabric of every community, working hand in hand to support everyone's well-being?
Imagine a world where access to good healthcare and education wasn't a privilege, but a right, something that's just part of the community you live in.
It's a powerful vision. And the Central Center model, it gives us a real-world example, a little beacon of hope, showing us that a fairer, more empowering approach is possible.
So as we wrap up, let's zoom out a bit. What are the big lessons our listeners can take away from the Central Center's approach?
The first one that jumps out at me is the power of integration. Breaking down those barriers between healthcare and education, recognizing that social, economic, even environmental factors, they all play a part. That's how you create solutions that really work, solutions that last.
It's not enough to just treat the symptoms.
Right.
You got to get to the root of the problem. And that means looking at the whole picture.
Exactly. The second takeaway, I think, is the importance of really engaging with the community. Change can't be dictated from outside. It has to be driven by the people who are most affected.
It's about listening, respecting their knowledge, and nurturing that grassroots leadership we talked about.
And the third takeaway, it's the power of collaboration. The Central Center shows us what can happen when you bring all these different people together. Healthcare providers, educators, community leaders, businesses, residents, everyone working towards the same goal.
It's recognizing that we're all in this together. We need each other to make real, lasting change.
So what's the final thought you'd like to leave our listeners with as we wrap up this deep dive?
The Central Center model is inspiring, but it's not a magic wand, right? It takes commitment, resources, and a willingness to challenge the way things are usually done. But it shows us a better path is possible. It's a call to action for all of us to find ways to build healthier, more vibrant, fairer communities.
Beautifully said. Whether it's volunteering at a local clinic, supporting a community garden, speaking up for policies that address health disparities, or even just talking about these issues with our friends and family, we all have a role to play.
Change doesn't happen overnight, but every step we take, every connection we make, it makes a difference. So let's get out there and be the change we want to see in the world.
And on that note of hope and possibility, we'll wrap up this episode of The Deep Dive. Thanks for joining us on this journey of exploration and inspiration.